Yeah, so I'll fix that and start him on food. There's no reason to not give him any food today. Like I said, I just took over for today, so I'm meeting all the patients today. I think the plan was that, I think the doctor who had him on yesterday was thinking that we might need to intervene. So his left kidney, the kidney that Dr. Mulseni did surgery on, is still not completely blocked, but partially blocked by blood. So since his surgery, there's been clot that's developed and it's sort of blocking the kidney.
To be just so we have been told it's the right kidney that has problem so far. So the left was okay, the right has because it has a stone moving.
So he's got a right kidney. Basically, he's got two things going on. I'm only going to tell you what I know, okay?
Of course,
and I looked at the pictures today.
Sure,
So when I look at the pictures, his left kidney is swollen, okay? And it's got swelling because you can see blood clot that goes down from the kidney into the drainage pathway of the kidney. So that would be from after his surgery. And there's also some blood clot in the bladder as well. And the right kidney is not blocked. There is a large stone there, but it's sitting in a location right now, at least, that is not blocking the kidney. So the problem when we call this clot obstruction, and it's almost like having gum inside the drainage pathway. We can put a tube, which I know he had problems with before, and we can put a tube up to try to bypass the blockage, but oftentimes when the blockage is caused by clot like this, if you think about it, it's like having really, really sandy water and then trying to put a pipe to drain it. It just blocks the pipe as well. So oftentimes if we put a stent up, it doesn't fix the problem. The stent itself just gets blocked by clot. It's not the same thing as when there's a stone there, because the stone can't block the pipe, but the clot often blocks the pipe. So if we were to do something on the left side where the clot is, we would have to put a tube in his back into the kidney, and that would allow the kidney to drain. The clot will go away with time by itself. The body has what's called enzymes. They're basically ways to dissolve the clot on the left side. So if we had to do something, and the reasons we would have to do something would be if he wasn't getting better with antibiotics and sort of conservative treatment, if he was having terrible pain on the left side, then we would have no choice. We would have to do something. Then we would put a tube right into the kidney so that eventually, hopefully, that clot would just dissolve and go away, but he would be living with this tube for a long time. Now, thankfully, his kidney function values are okay. So his creatinine today is 107, so that's normal, basically. So again, and the thing with clot is, it doesn't mean that it's totally blocked. The urine can make its way through the clot. So with time, these things usually just get better by themselves. So he's all of the things that we see in the blood work in terms of him making improvements just with conservative management, which is antibiotics. He's doing that. Obviously, he's not himself and everything else. And the problem is when somebody's 83 and they get sick, bacteria in the urine and all the things that have been going on, the whole body gets sick. And when you're 83, it can take time for people to normalize. And when they're stuck in a hospital in unfamiliar settings, people tend to get confused. And it's not like you getting sick and getting better. It takes a lot longer for somebody else. So he's getting better, at least on paper. I have no issues with him having something to eat at this point, because putting this tube in, I don't think we need to do it yet. That might change if something changes. But there's not a lot to do right now. Really what we're doing is just keeping him on antibiotics.
Did the new antibiotics start to work?
Yeah, it looks like it. The numbers are great. His white blood cell count when he came into hospital was 30, right? I mean, it was really high. Let me just find his chart again here. Give me a second. So it appears that he is having good response to therapy, but he was, he's got bacteria in the blood, bacteria in the urine, so he's sick. If you think about it, when you have bacteria in the blood, it's being pumped everywhere in your body, your brain, your heart. So every part of your body all at the same time is having to fight this infection. And so again, when you're AD3, if you have bacteria that's getting to your brain and you have bacteria getting to your heart, it's like getting hit by a truck. It's a recovery process. It's a big deal. But thankfully, he's getting better without us putting him through anything. I don't think putting a stent in makes sense. At least right now, the other kidney's not blocked. So he's basically developed an infection after surgery, partially related to at least partial obstruction of that kidney. And now we just give it time. So I'm happy for him to have something to eat. I'll change the order now on the computer. There's not much for me to do right now. I'll keep him here until he's, getting better, basically. We'll keep it on his blood work and make sure he's getting better.
So you think the antibiotic is start working?
It
Because
is.
until the other day, it didn't even work.
Well, antibiotics can take,
changed.
remember, he's got bacteria everywhere through his bloodstream. So it takes, even when people are getting the absolute right antibiotic and the strongest antibiotic on earth, people will spike fevers for 2 to 3 days before you get better. And because you're not just killing the bacteria, there's toxins that are released that have to get out of the body. So even with the healthiest patient who's got a bacterial infection in the blood, you don't expect to see people sort of getting better right away. It just doesn't work like that. But what I am seeing is his kidneys functions better, his white blood cell count is getting better. So those are both signs that the antibiotic's doing the right thing. So it's right now it's a bit of a, we wait basically. There's nothing else that I would do at this point. The only other thing to do would be to put a tube in, and at least the way it's looking right now, it's another source of problems as well. It can fix problems, it can cause problems. And if he's getting better otherwise, if I start seeing his white blood cell counts getting worse again, despite the antibiotics, then we may have no choice. I'll have to call you and say we got to put the tube in. But I'm hoping we can do this all conservatively. And he's going to need to be on antibiotics for at least 2 weeks, maybe longer. That doesn't mean he needs to be in hospital for 2 weeks. To be honest with you, the best
As soon
place.
as he can just there's no.
Yeah.
The pain was unbearable yesterday. He's
Where was his
sleeping
pain?
now.
Which side was his pain?
Well, it wasn't really pain. It was like some sort of mild seizure. He
Yeah.
was start shaking
Yeah.
like crazy,
Yeah.
and then blood pressure up to 19 and a
Yeah.
half, and then it wasn't like the pain that he's complaining. He
Yeah.
couldn't even talk. It was like cold, like ice.
So that's him still having spiking fevers from being so sick.
yeah.
And that doesn't mean we're on the wrong antibiotic. It just takes time to get better. And we have patients who, I'll say 3 or 4 days of this and going up and down until things start to settle down. But his best place to be when he's safe to do it is going to be home, because he's got familiar environment, familiar food. When you're older, we know that people get better quicker at home because they can reorient themselves to their surroundings. He's not safe to do that at this point, but the moment that he's starting to be less confused, we can get him eating and drinking, so you don't think he's going to be a problem with that he needs an IV, for example. Then we could get him home. We can give this antibiotic
No, there's
at
no
home.
need to be home. We're not rushed.
No, I know.
But,
But I'm saying it's actually better for him to be home
better.
when it's safe for him to be home.
okay.
That's all. Because there's no reason to keep him on an IV antibiotic in the hospital if we can give it to him at the home, basically.
Of course.
And if I think sometimes we have to switch him to a different type of IV, a special type of IV that can stay in for longer. So I'm gonna check, and if we need to do that, we can arrange that here in the hospital.
Before we go home.
Correct.
Okay.
Yeah. Just because otherwise they have to change the IVE over and over in his arms, and it's.
It has a very thin vein, so it's
Yeah.
really hard to get.
Is that
out.
right?
Yeah, very
Yeah,
hard.
so if that's the case, we put sometimes something called a PICC line in, which is a special IV that can stay in for many weeks safely. So if we think that's going to be necessary, I can arrange that. It's not a
Okay.
big deal.
Let's see.
Okay.
Thank you so much.
So that's where we're at. I'm going to be around all of this week and on the weekend if necessary. So I'll be here.
Thank you.
My last day.
The nurse said is the infection specialist is going to come.
I
in
asked them
soon.
to come by.
Yeah.
Yeah, because I want to start planning. I don't think he's ready to go home.
No.
But I want to start planning for that and see what they say, because sometimes We have to keep people on IV antibiotics. It's a big pain to do that. If we can switch him to something by mouth that's safe and is going to work, then that's a better idea. So we'll see what they say. If they say he needs to stay on the IV, which is fine, I'll ask them to insert that special line.
Okay. Forgot your name.
Kogan, Kogon.
Thank you so much.
No problem.
Appreciate
Nice to meet you.
Thank you.
Bye-bye.